Hi, this is Dr. Ritesh, minimal access surgeon working in Narayana Health, HSR Layout, Bangalore. Today we'll be talking about hernias. What basically is a hernia? A hernia occurs when part of your insides bulge out through an opening or due to a weakness in the musculature or the tissues that contain it. So most often the hernias that occur are usually because one of your abdominal organs are trying to push through the walls of the abdominal cavity. Hernias gradually occur as and when the age progresses, usually in old age, or sometimes due to a congenital defect, or in women, sometimes post pregnancy when the woman is recovering from a pregnancy. So that's when the hernias occur. It can also occur due to an acute trauma or any kind of injury, or due to any previous abdominal surgeries that the patient has undergone. These are the most common issues. Let's talk about some of the types of hernias. The most common types of hernias in men constitute inguinal hernias, which are almost 75%. In women, most commonly it is post-pregnancy umbilical hernias. Sometimes they might also present as a birth defect. Let's come to some of the most common hernias that present on the anterior abdominal wall. These can be ventral hernias, which present as an epigastric hernia, which comes on the upper part of your abdomen. Sometimes the hernias can even present post-surgery as an incisional hernia. Usually women undergoing any lower abdominal surgeries or men undergoing any anterior abdominal wall surgeries, they can present as incisional hernias. Some of the types of hernias that are internal are hiatal hernias, where there's a layer of muscle that divides your chest and your abdomen. So where the food pipe enters your musculature here, which is called the diaphragm, if this widens, your stomach tends to be pulled up into the chest cavity. So this can present as a hiatal hernia. So this is one form of an internal hernia. Talking about the seriousness of the situation, how serious are hernias? Usually hernias aren't serious. Most hernias aren't. But as the time progresses with a hernia in your body, it does get serious because sometimes a loop of intestine or some part of your organ gets stuck in between the hernial orifice, and which causes pain. If you ignore it even after this, sometimes it might go for strangulation, which means the blood supply to the particular organ or the intestine is cut off. This is when they get serious. What are the common signs or symptoms? How do you see hernias? Usually whenever you talk about hernias, patients usually present with a visible lump whenever they change their physical position, when they're standing, when they're sitting, or when they're trying to get up from the bed. You see a visible lump in patients. And if they don't have a visible lump, and if you're initially starting off showing symptoms of hernia, usually you present with a dull aching pain, a dragging pain, which usually restricts you from getting up or either sitting down, or sudden jerky movements. So these are the most common symptoms that we usually encounter. And in women, most commonly they have a protruding belly button post surgery or post their delivery. So this is how we see it. What are the risk factors? See, there is always a risk factor in hernia when you're standing for long hours and working, or when you're bending awkwardly, stretching awkwardly. These will increase the wear and tear of your musculature. Secondly, you can have a chronic issue. Patients might present with chronic cough. Patients might present with chronic sneezing. So this generally tend to increase the pressure in your abdominal cavity. So whenever there's an increase in the pressure in your abdominal cavity, organs tend to move out or bulge out from the walls of your abdominal region. So this is most commonly seen. Third thing, if you've got an acute trauma, if you're met with an accident, road traffic accidents, usually whenever you present there and after you're treated, sometimes after the wound heals, the muscles are a little weak, and that gives a nidus to break open and for the organs that are inside to jut out. Sometimes you might have a previous abdominal surgery, you've undergone a surgery, your abdominal walls are weak, and from the lowest or the weakest point of your abdomen or your musculature, organs tend to bulge out. Usually it is the intestines or your omentum. Let's talk about complications of hernias. Do they get complicated? Are they complicated? Basically, hernias, when they're initially diagnosed, do not go for complications, but when they do go for some dreaded complications. Sometimes a loop of your bowel, that is your intestines, might get stuck in the hernial defect, or sometimes the fat covering your intestines, also known as omentum, might come and get stuck. This might give you an uncomfortable dragging pain so which might be constant. Sometimes if you choose to ignore this and you continue with your hernia, it might get bigger, or something else might get stuck in the hernial defect, and that might cut off the blood supply. This also gives rise to another complication called strangulation. So in strangulation, a part of your bowel, that is your intestines, loses the blood supply, and this can go for necrosis. This usually goes in for a very dreaded complication. How do you treat it? How do you diagnose it? So how do you diagnose it? Hernias are very simple to diagnose. A simple physical examination can diagnose that you have got a hernia. In men, it quite presents naturally as a swelling in the scrotum when it's an inguinal hernia. In women, definitely there's a protruding or a bulging umbilical region, which gives rise to an umbilical hernia. So a simple physical examination would suffice. In case you want to know the extent of hernia or the contents of a hernia, then you'll probably have to go in for radiological examinations, that is either via ultrasonography, or you can go in for a CT scan, which gives you in-depth and in detail diagnosis of your hernias, your defects, and what are the contents. How do you treat it? Basically, if you want a permanent solution, it's always surgery. Yes, you can either go in for an open surgery or you can go in for a laparoscopic surgery. What we basically do here is we repair the hernias. We close the defect, we push the contents inside, and we make sure that we reinforce the walls of your abdomen through a foreign body, usually a mesh that is made of Prolene. This is how we treat it. What are the risk factors of a hernia? How do you develop hernias? Usually it's a chronic issue, either chronic cough or chronic allergies which make you sneeze regularly. Sometimes the patient's present with chronic constipation. In women, generally post-pregnancy, yes, the abdomen tends to get a little lax after your delivery. And finally, you might have some kind of an abdominal surgery previously or some kind of trauma that might give rise to an incisional hernias, where a part of your musculature is weak, and from there the organs tend to protrude through your abdominal wall. So to conclude, if you or your family members or any loved ones are suffering from any of the symptoms that we've spoken about or discussed in this video, do walk in for a consultation, and we will try to resolve your issues as much as possible, either through an open approach or a laparoscopic approach, and we do tend that you lead a healthy life.